Hi, welcome to EDSC 561. This is week 6. This week you just have your discussion board that is due, and I look forward to hearing your group assignments during week 7, our live session. So this week I'm going to be focusing on recovery and supports, psychological supports after a incident or after a violent incident or a natural disaster. And also, we'll be talking about in chapters 7, recovery, just all about recovery. So, I'm going to go ahead and share my screen with you as we go through the PowerPoint. All right, so we're talking about chapter 8, which is recovery and psychological supports. So what happens when we are getting to that point? So we're back at school, a situation has occurred, and how do we continue? And how do we know and assess as the mental health professionals on our campus, how do we know and assess that people are going to need additional recoveries? And how do we structure the recoveries to include the masses that were involved and to help them, and then slowly over time to continue to share and give supports to those who need long-time recovery. As we talked about natural disasters, we need to make sure that we're giving psychological supports. It is advised at least 1 year for the active shooter or violence, and that it is up to 6 years potentially for natural disasters because it takes more time for students to recover through that natural disaster, depending on how um, damaging it was. So it affects people in a crisis and cognitively, emotionally, and behavioral, as we know this. So we need to make sure that we're putting the supports in place for those who need it accordingly. It can help people who did not directly experience the crisis or be affected by it. We talk about that as it relates to people who have been triggered because they've experienced something like that. So they may need supports for a few weeks or so, but maybe not as long as those that were directly affected. We also need to ask the question, will everyone be exposed to trauma? Show symptoms. Not everybody will show symptoms of stress and a stress disorder, but we may see it. We may not see it in the first weeks, but then it hits them later on in time. And it could be because they were triggered by something else in their community or at home that triggered it because they were managing well after the event from school, but then now it's entering their home. And so now it could affect them more so. What's the difference between acute stress disorder and post-traumatic stress disorder? So what is the person who is consistently being affected, which is our acute, and then our post-traumatic is as according to that most recent event. What is the difference between normal grief and traumatic grief? You know, the normal grief, we go through the stages of grief. As long as we're moving throughout those stages, we are safer because we know that we're processing. And on different days of the week, we're feeling those different emotions as we move through those different stages. And they're not linear according to those grief stages. Those grief stages, you can hop and jump and feel what you feel throughout it. And then we have the traumatic grief, where we might see a little bit more of um, not inability to cope, tantrums, losing their ability to communicate, um, showing acute stress, and maybe screaming or yelling and not processing information correctly. And then how do we know when we need to refer a student for mental health? If we've seen these signs for 6 months or more, we probably need to refer them for additional therapy. So, trauma can occur direct or indirect exposure to an event. It can be real or perceived, to a threatened death, serious injury, or sexual violence. So, it could have happened to them, or they could think it's going to happen to them. And either way, it is problematic. Helplessness is defined as an aspect of the trauma event. So sometimes you can't even care for yourself because you feel so helpless or you're unable to move. It's that fight or flight, that frozen experience, and you feel like you can't, help yourself through the process. You may recognize the trauma, but you may not know what to do with it. And you may need someone to teach you how to regain control. Fear is the natural reaction to the horror and experience that the children experience about or after, during or after the trauma. So we're going to see a lot of people afraid to go into the classroom, afraid to go into the bathroom alone. So these are things that we have to consistently be aware of. Horror is overwhelming and it's a painful feeling caused by something that is frightening, shocking, terrifying, and revolting. So we need to make sure that we are doing that. Some school-based supports for students is we like to categorize them through this the ages 1 through 5, 6 through 11, and then the adolescents 12 through 17. So these are where we can find supports for these age groups. Psychological first aid, the school should provide a continuum of services to students experiencing that distress. Students should be offered an opportunity to talk, ask questions, and have inaccuracies corrected. So there's nothing that states that we should not talk about, even with suicide. There's no evidence that says that we shouldn't talk to students about these traumatic events. If they have questions about it, they need to go to an adult that they feel that will answer them openly and honestly. Sometimes they ask, when will I get better? Well, we don't know the answer to that, but we tell them that we're here to support them. And hopefully by getting their feelings out and trying certain things, that they will be able to get back to normal. I think sometimes people just want to feel normal again. Students should be given the chance to help others after a crisis, like sending packages, air packages, writing letters and cards. We can do this to another state if they've experienced something like that, and that helps them to increase their empathy. We should also encourage positive coping by staff and and frontline services with the students. So, a positive model can be a significant recovery for students. If we're doing it for one another, they see other adults and adults consoling adults. This is how they then start to console one another. Schools should develop robust communication strategies. So, how will we get all of our information out and ensure that it's the most accurate information so that we can dispel any of the rumors that might be occurring in the community? We should protect our students from media exposure that may re traumatize them. And this is an important factor as well. So we need to know and understand the diagnostic criteria for acute stress disorder. We can find that in the DSM-5. We also need to know the criteria for post-traumatic stress disorder and traumatic grief as well. All right. So you can refer back to your DSM-5 so that you can understand when it's time to refer for those different needs. So after a death on campus, and it can come in any format. It could be away from campus. It could have occurred on campus, whatever that may. It could be with a student. It could be with an employee. we need to have protocols and goals that we are going to do to support those that are grieving, assist the school to returning to normal routines, identify and support those most at risk for severe reaction to the death, and also, in the case of death by suicide, postvention to prevention contagion is also really important. So many times we've had other students, um, and some of the statistics for the active shooter, those that have survived often tend to take their life. So we want to make sure we're watching those in the event of that particular situation as well. Um, Postvention followed by suicide. So we want to prevent contagion. So we don't want others to do that. And our Suicide Prevention Resource Center has lots of resources, and they have an effective, up-to-date postvention plan with resources to implement it. And they're the most effective strategies. So you don't want to deviate from this to ensure that other students do not progress towards suicidal behaviors. So definitely download this resource. I'll share that link with you after um, I finish with the slides. We need to verify the death. We need to contact the deceased family. We need to convey the school's condolences, ask about funeral arrangements, and find out how the family wants this information to be communicated to the school community and participate in the funeral arrangements. So, not often, they might want it to be family only. They also, if they don't want you to share that it was through suicide, you have to take that into consideration, and you cannot go against their wishes by just sharing what you feel is important. We need to reassure the family that the school will be a continuing safeguard, and make sure that they receive all of the deceased personal belongings when they're ready to. Let the family know that we're providing counseling for the students, the staff meetings to assist with their grief, and then also maybe connect them up with any outside agencies. That's what my social worker would do at that time, is to connect the family with any type of grief and support them, and go out to the homes and continue to support with them as long as they are open to it. Invite the parents and guardians to share the names of the children and school aid family and friends that they may not have known. And then safeguard the deceased belongings. Announce the death to the students. This is a very fragile situation. You need to make sure that you're following the suicide prevention protocols, because theirs have been the most effective. And then following the schedule of the deceased. So for group activities, we may issue topics for discussion during the sessions so that people can feel like they're being connected, and they're have someone to lean on as they go through the different responses that they're going to experience. We need to consider the relationship of the student's relationship with the deceased. We need to see about individual reactions to death and whom they may have shared them with. And we need to make sure that we are not misinforming, or rumors aren't being spread about the death. We need to make sure we give parents, family, friends helpful information about grief and symptoms associated with depression. And then we also need to make sure that students have and are aware of the memorial services. And then students have the crisis hotline to be able to discuss that and have talks with that. Whenever possible, we need to have student-initiated support groups, which would include one or two well-liked adults, so that they can support and have a discussion with them. And then we need to have a screening for anyone who should be individually contacted. And we're kind of looking at close friends of the death, any witnesses to the events, students who have experienced recent loss, students who are receiving mental health or drug and alcohol treatment, funeral attendees, and students who identify themselves as needing help. So these are all the categories that we want to place the students in order to be able to help them and provide them with the services that they need and the length of services that they may need after the death. Certain students will be more at risk for suicide and depression and should be screened individually by qualified mental health professionals and by school counselors in consultation with their qualified mental health professionals so that we can get them to the right ongoing support that they may need. We need to consider these factors when we are screening. Students' exposure to death, relationship to the deceased, and the participation in the funeral, the student's current and past mental health care, including any time he or she was in counseling, whether the suicide tragic loss caused any exacerbation of any mental health symptoms that the student is already experiencing, and any current or past history of suicide for themselves or any family members. If it happened in their family, they're more at risk. We also need to pay attention to any symptoms of depression experienced by the student and whether the death caused an exacerbation of those symptoms, any past or present involvement with the legal or juvenile court system, any history of alcohol or drug abuse, access to firearms, even if they're locked. This is important. Alcohol or other drugs, stressors to the student's life. If the death was caused by suicide, any communication about suicide between the student and the deceased. If it's determined that the student is at risk for suicide, depression, or other mental health disorders, then we need to take these actions. Contact the parents and the guardian. We need to do our risk assessment. This is important, and facilitate a referral and advise the parent or student or guardian to remove any firearms, alcohol, or the drugs from the student's access. We also need to pay attention to our feeder schools or adjacent districts that may have students affected by the death and identify and contact these sites. Okay, so that covers our how we recover and move from recovery after any type of death, right? We also need to be aware of communication, support teams, evaluations, follow-ups, memorials, student-initiated memorials, yearbook memorials, graduation activities after death, and any anniversary dates. Okay, thank you. That pretty much covers our topics for this week. What I want to share with you now is the websites that provide information to us. Here is the one on Suicide Prevention Resource Center. This is one that you want to kind of start for yourself as a place to be able to find resources immediately in the event. Finding the websites, remembering the titles of the names of the websites that we've given you in the class is kind of a difficult thing, especially when you're going through the crisis. So making sure you have these available because you'll get that phone call. And I did get a phone call in one evening, late in the evening, about 10 o'clock. I didn't sleep that night. And I was just going through all the materials and things that I had on my website to be prepared for the next day and to be ready and making sure because that we had everything together because this was prior to the policy and procedure on suicide and suicide prevention. So when I had this attempted suicide, this was where I was gathering all of the information that I had through teaching and bringing it to work and applying it and showing them that this was evidence-based. It's the most researched and, when we didn't have that in place. Okay. So having these available is really important. All right. Thank you very much. Have a wonderful week 6, and I will see you in class week 7.